Okay, we've got a 61-year-old man with an elevated PSA of 5.19 recently, but there's a history of 2 negative biopsies. And the overall gland volume of 55.4 yields a PSA density of 0.09 nanograms per ml per cc. So a very low PSA density. So we've got a lot of factors swirling around us that point us away from the diagnosis of cancer. And that could potentially influence how we attack this lesion. So here's an axial T2. I'll scroll a little bit just to give you a feel for it. And some of you may see the lesion right away, others may not, but here it is right there. And there is a little bit of diffusion restriction. Here it is right there. And that's going to make most of you nervous. So the amount of diffusion restriction is mild, as you can see from the intensity, or lack thereof, on the high B-value diffusion image. The hypointensity is not that profound on the ADC map. So you probably would go with the seesaw in between tweener PIRADS 3. Or not. The original reader went with a PIRADS 3. But let's talk about another way to approach lesions like this. We're going to talk about the Leikert grading system, which one of my Aussie colleagues has informed me is analogous to, hotel grading on TripAdvisor. So let's see. What's a Leikert 1? A Leikert 1 would be no cancer. A Leikert 2 would be normal with some abnormalities present that are not cancer. A Leikert 3 would be possibly cancer. A Leikert 4 would be probably cancer, and a Leikert 5 would be cancer. Now you're saying to yourself, okay, how is this any different than the PIRADS grading system? Well, when you walk into a hotel and you see all the pretty chandeliers and you have a beautiful room, you say, okay, well, that is a 5-star hotel. But what if the food is lousy? What if the service is bad? What if the beaches are smelly? You haven't incorporated all the factors that go into making it a really superior venue to vacation. And that's kind of what the Leikert system is all about. It's not just about the strict PIRADS criteria. It may be about how much diffusion restriction you have, what the PSA rise has been, what the PSA density is, where the lesion is located, just how encapsulated is it, are there microcysts, and innumerable other indirect signs that you might use to assist you in your diagnosis. For instance, you know that in this area up front right here, it's a very dangerous area. So you might be more aggressive in that area with extreme diffusion restriction than you might be otherwise. Or if you get up high near the central zone, where things are very gray and intermediate, let's go up high in the central zone area, you're looking more for symmetry between the two sides to make a decision, since signal intensities can be very amorphous in this location. So you're using the entirety of your experience, the compendium of your experience, both visually and all of the clinical factors that will push you one way or another and improve your odds of being right. So the Leikert system is more comprehensive both visually, intellectually, and clinically. So in this particular instance, we might say, okay, we've got a little nodule abutting the capsule on the left. It has some diffusion restriction. The ADC map characteristics aren't that strong. And when I go to my DCE MRI, let's go there, it doesn't look any different than anything else. There's no hypervascularity. So because we have 2 negative biopsies and we got a low PSA density, I would go with a Leikert 2, and I would follow this one up in a year. Because again, the patient has already had 2 negative biopsies, and negative biopsies beget more negative biopsies, just like they do in the breast. Now let's take another caveat. Let's take the reverse. We have this tweener lesion here, a little bit of diffusion restriction. But let's say the vascularity was pretty bright right in this location. So now we would say, okay, it's a PIRADS 3, but now we have hypervascularity. We're going to use the DCE, dynamic contrast enhanced MRI, to add 3 plus 1 to give us the equivalent of a 4. So we're using the DCE MRI to upgrade our nodule. Now that didn't happen here, but I'm giving you a hypothetical circumstance. Now a 3 plus 1 in this scenario is not as strong as a true PIRADS 4, where you've got a nodule that's under 1.5 centimeters and the diffusion restriction is really intense and the ADC is really black. That would be a much stronger scenario, or a stronger scenario, and more likely to have a higher Gleason grade than this 3 plus 1 scenario, which is equivalent to a 4. So this case, originally read as a PIRADS 3, but downgraded or downbraided as a Leikert 2 for all the reasons mentioned.